Research and sales data has clearly shown that alcohol use during the pandemic has certainly increased.
And now that things are slowly starting to become more normal, experts say that this is a good time to sort of reassess your drinking habits that you might have developed over the past year. On this Wellness Wednesday, our Dr. McGeorge is here with a look at who is at greatest risk and where you need to start if you need to cut back.
A study published in JAMA found that overall alcohol use increased by 14% in 2020 compared to 2019. And for women specifically, the increase was 17%. Even more importantly, though, for women, there was an increase in the results of a self-reported score that suggests alcohol-related problems increased for nearly 1 in 10 women.
We've seen, I would say, an increase also in women using alcohol, not only more significantly, perhaps daily, but earlier in the day. And then also kind of more of a frequency or heavy drinking.
Dr. Elizabeth Boulot is a specialist in addiction medicine and oversees addiction services at Henry Ford Maple Grove. She points out that women aren't the only group at risk.
We've seen more people that live alone, to be honest, have been drinking more.
Isolation and loneliness are generally the cause, but
with women in particular, and this could be men too, but we've seen a trend with the homeschooling, increased responsibilities at home, not knowing the financial situation at home, and then again, the isolation.
Now that things are beginning to normalize, this is a good time to reassess alcohol habits that might have changed during the pandemic and be ready to have an honest discussion with your family or your doctor.
If you're noticing that you may be drinking more than you used to, or using it to sleep or deal with anxiety and stress, to have that conversation.
Also, be on the lookout for bigger warnings.
In terms of red flags, continued use despite negative consequences, I think is a big one. Having cravings, a continued desire to quit or stop, but unable to. Then, of course, health issues and kind of interpersonal relationship issues.
In some cases, a person's alcohol problem may be severe enough to require professional help.
What I would suggest is first just having a conversation with, the medical provider, determining if this is somebody that needs to consider detoxification in actual inpatient treatment, or if this is something that can be done more of just cutting back down. If somebody's drinking where it's considered still in the moderation, again, looking at embracing new healthy habits, working out, finding different things that folks used to do pre-COVID that are able to do now.
If you have a concern your drinking may have reached a concerning point and you have trouble cutting back on your own, the first step is to talk to your own doctor. If you don't have a personal physician, there are also many helpful online resources that can move you in the right direction, and we'll put a link to those on the health page at clickondetroit.com. First and foremost, though, don't be afraid to be honest with yourself about your drinking.